Patients with lower body mass index under 23 may not consider themselves suitable for fat transfer procedures such as Brazilian butt lift. However, patients can still achieve dramatic results by moving even a small amount of fat. A skinny BBL is typically a BBL procedure done for patients with low body mass index. In other words, in those with very little fat tissue. It involves using liposuction across multiple areas of the body, often more areas than the usual, to collect any amount of stubborn fat. These areas may include the stomach, the back, the arms, the thighs. The fat is then purified and prepared for injection into the buttock. At the CREO clinic, I use my own method of fat transfer known as the buttock enhancement and superficial fat transfer of fat, or the best F technique. This helps to reduce the risks of pulmonary fat embolism by inserting the fat above the gluteal muscle and not below or into it. I also use an ultrasound scanner device to see the position of the fat while I'm transferring it and ensure that no fat is injected into the muscle. The accurate placement of fat also helps me to craft the desired buttock shape that patients are seeking, such as the bubble butt, for example. A skinny BBL comes with several key benefits. First, patients with lower body mass index often struggle with small but stubborn pockets of fat that can't be reduced by diet and exercise alone. Liposuction can be used to harvest this fat and sculpt these targeted areas. Secondly, injecting this fat into the buttock and hips helps to shape fuller buttocks and rounder hips and remedies any hip dips. Often, the best results are seen in thin patients as very small changes is more noticeable. You may experience side effects such as post-operative swelling and bruising after surgery. A skinny BBL typically follow a similar recovery timeline to the traditional BBL, and most patients feel able to return to light daily activities and work 1 or 2 weeks after surgery. You should wait for the operation site to heal before engaging in more strenuous activities, which usually takes about 3 weeks. Your final results will become apparent after all the swelling has gone and the fat graft has fully stabilized, which takes about 6 months. You will then be able to enjoy the full effect of your newly toned body.